Welcome everyone to our second episode of our Vida Pod. I'm the host. My name is Devi Nambalangodege, and today I have a special guest who's one of our prominent doctors at Vida. Actually, one of the guys who have been there since the inception of Vida. I'm honored to have a chat with him about the healthcare sphere in Sri Lanka from a doctor's standpoint. Talking about this doctor a little bit more, he was there since the day one from Vida, and he's been such an inspiration. He has been there during the hard times and the good times, and he's a known figure if you come to Vida. And if you look at our socials on TikTok and Instagram, you will see him, and everybody loves him. So,
that was very sweet. That was very sweet, man. That was very sweet. Thanks, man.
Dr. Buran, we have Dr. Buran here talking about patient-centric care and elderly wellness in Sri Lanka. Welcome, Dr. Buran. Machang, how are you?
Good, man. Thanks a lot for having me.
So we're going to talk about few things, but before that, How's everything? Like, how's the patients coming into Vida? Are you enjoying here? Like, what's happening in that perspective? Before we dig down to the whole, I have some questions that I've already, got through ChatGPT. So we're gonna look through that as well. And so how's everything going?
Things are good, man. Things are good. It's been hectic. Anyway, July is a month where we usually have less patients.
Yeah.
So I think it's a month where we have a lot of patients who come for chronic illnesses.
Okay.
People who have got BP, high blood pressure, sugar, they come routinely to get themselves checked.
All right.
So we don't have more of the acute illnesses like fever.
Yeah.
When you send people from Growth Inc. who have actually got chest pain, and it's just gastritis. Those things are a little less, but we have
some of those people right here in the production team.
Exactly. But it's been good. It's been good. There are days where it's really hectic, but as long as you enjoy what you're doing, I think that's the most important thing, and I'm loving it.
Right.
My wife's not here, so that makes it more.
I get more time. You'll be sad about it than missing her,
I am,
right?
but then I get more time to work. And,
okay.
So that's again a good
I
thing.
hope she doesn't see that part. We're gonna cut that off.
I know, these guys will make sure that they cut it off. Yeah.
Before we start, I wanted to ask you, before you started working here as a regular doctor, what did you expect from here? Right now I'm pretty sure there's a lot of hospitals, clinics are wanting to, have you there in their establishment. Why are you sticking with us? Give me with three words. I'm not putting on the spotlight right now, but maybe why Vida?
Well, I think, honestly speaking, this is a question that I kept asking myself. But I think the time that I came for the interview, I wasn't even wanting to come. I remember Devi called me once, and I'm like, bro, seriously, I'm not interested. He told me, I'm not interested, because the mentality I had was there are a lot of doctors in the private sector, right? I won't say a lot of doctors, but I had this mentality where private sector people, nikang boruwata, you get blood tests done, unnecessarily doctors tell you to do things because, they're getting something, out of it. I had that sort of mentality, which I felt like, again, right now I feel it's wrong because now I am in the private sector.
Right.
But one thing that I really picked up from your conversation, where you spoke about your basically grandmother and how you felt so crippled that you did not know what to do because you were pushed from one place to another without getting the right help.
Yeah.
And that's when I felt that this for you was very personal, which is why you created this organization. And I've always wanted to make a difference. I've always wanted in some way to make a difference, and I felt that with your personal sort of mandate, this place would make a difference. And I think we have made a difference. You go and look at our reviews
Yeah.
on Google, you will see how we've changed people's life and how we've made a difference to
Yeah.
their way of things. And I think today is about that, I guess.
Yeah. So our topic is like, before we started this podcast, I mean, today's episode, Buran and I had a chat on. There are so many things that we can talk about in the healthcare system, especially in Sri Lanka, how we can improve and stuff like that. And actually, Dr. Buran is the one who actually came up with like, okay, patient-centric. Like that, this is the whole reason that we have this organization, and like this is what we are working for. Our nurses, our ambulance drivers, our reception, our management team, everyone is working towards that patient-centric, to give the 100% to the patient, right? Including doctors, nurses, everyone. So I think this is a very fitting topic. So I will just even though I got this from ChatGPT, I actually did my research. I just put it there and got it a little bit cleared out.
For sure.
Just want to let you know on that, everybody who's looking at it. So actually now I think you answered this question, like, what does patient-centric care actually means to you? Like, what does it mean to you right now? Like, I mean, you worked here for you've been here for 4 years. I feel like the perception is different from the first year to the fourth year. I mean, we're heading to our fifth year right now. I feel like the perception is different from your first year. What is patient-centric care actually mean to you right now at this point?
Well, patient-centric care, for people who are watching and for people who want to understand, or maybe how I see it, it's like you're going to a tailor, right, and you get a ready-made suit, right, versus going to the tailor, getting your fit on properly, making sure you have, because some people like it very tight, some people like it quite loose, so basically patient-centric is making sure that you have catered to the needs of your patient. Right? You need to make sure that you've properly tailored to what he wants, and whatever that he's going through, you make sure that you emphasize on those particular things, and you're able to help him out in whatever way that he has asked for help.
Right.
So that's what patient-centric for me. I mean, in the terminology, I can go on about it, but that's what it is. So if you have a patient, how you can make sure that when he leaves, he has sorted whatever problems that he has, and he has left with knowing that he's looked after very well.
Right.
So there are a lot of components of it. Right. And with our conversation, let's get deeper into it.
Right. And I want to add to this. We're talking about patient-centric now. When I think about patient-centric, call me biased, I think about Vida, right? Maybe because we have some sort of a system where you just told me we kind of had I don't want to say interview, but we had a chat before you became part of Vida and the organization. And something that I always thought, if you go to any other hospital, you have an appointment time, right? 7:30, it can be at 7:30, right? And the doctor would arrive at 8:30, 8:45, not, actually, thinking about the patient's time. And why do you think this sort of culture, now you've been in the industry for a bit, why do you think this sort of a culture where patients have to wait for the doctor? Why this thing has already have become a thing in Sri Lanka especially?
Well, the problem is, I really don't know how I'm supposed to answer this question. It's a problem that exists. I mean, I've taken my wife for so many sort of hospitals here for various things. And I mean, she's not from here, so she keeps saying, why is it that every time I've been given a time and no one's there? But I keep telling her, this particular person has gone for some emergency and it takes some time, or he or she is in another hospital and might have got caught with an emergency patient. And you can't blame the doctors as well, right? But I do understand that sometimes some people have limited number of hours because they're also quite busy, right? And everyone's got work and they have made some time, and then sometimes they come in and I wouldn't like to use the word waste,
Right.
but they spend a lot of time waiting for the doctor to come in.
Right.
And I think that's something else that you brought in. You wanted to make sure that when a patient comes at 7:30, if the reception has said 7:30, 7:30 is the time that the doctor will see the patient. And
Correct.
we have a thing where, we always try our level best to come before that time, so that we get comfortable. We have an idea as to who we are seeing, and we don't let the patient wait. I mean, that being said, there are times.
There are times.
Guys.
I
mean,
like
if
I'm
you
telling you, there are times.
If you speak to the reception, there are times where I keep on getting calls. Sir, patient. There's a first patient is here. There's another patient.
Yeah.
But we try our level best to make sure that we are there on time, so that the patient has not, because it's again something that is concerning, and they're like, okay, 7:30, I'll be seeing the patient.
Yeah.
Right. I mean, the doctor will see me and will give me a plan, and sometimes that creates an anxiety, when they're seated out here. But again, what do we do out here, right? Something that's amazing is, one of the nurses or the attendants will actually, offer them a tea or a coffee.
Yeah.
So, it's something like, okay, and then they'll keep them updated. Okay, the doctor's going to take a little bit more time because he's a little bit busy.
Yeah.
Which is
what we need to do. I mean, like, end of the day, in my perspective, what I think about a patient is when you get sick, right? When you get sick, now with all this technology out there, what you do is like, okay, I have sinuses and I have a fever and I have body aches. You put that on Google, probably the answer is you're gonna die in the next 24 hours. You're stressed out, right? With this technology, I mean, I'm not saying bad thing about technology, but like now in this time and age, we are so used to relying on ChatGPT, Google, things like that, right? Like you put whatever, like a symptom or something like that on Google, probably it might come out saying like, oh, you're going to die within the next 24 hours, which is not, like, no, that's probably not the truth. And like, a lot of people, when they get sick, they're pretty stressed out. Especially after COVID, during the pandemic time, like, we realize how the healthcare systems even in developed world and developing countries, like, it was put to the challenge, but like whenever a patient actually walks in, they're stressed out, right? They need to get, comfort. They need to make sure like they are taken care of. And it is from the person who's answering the phone to make the appointment, and when they arrive in a soothing environment, offering them a cup of tea until the doctor is there. Those are the small things actually that, paying like 50 rupees and getting a tea bag and putting it and giving it to someone does not cost a lot of money, to be quiet. It actually shows the humane side of healthcare, right? So that being said, I want to get into this thing. How do you balance the medical expertise with patient expectations, especially when they Google everything first? I'm pretty sure, Dr. Burhan, you see a lot of patients every single month, and I'm pretty sure at least 10 of, let's say 5% of them, they have already Googled and they have already come up with a diagnosis.
I would say that it's not 5%. It's more than at least 60 to 70%.
Yeah.
The first thing they do is now ChatGPT. They've got a list of differential diagnosis and they will start questioning it, which is a very common thing right now.
Yeah.
It's absolutely common.
People, yeah.
They'll be like, doctor, why don't you think it's this? Why don't you think it's this? And it makes it difficult actually. Right. But it's very important. Right. It's very important that you allow them to ask these questions. Right. Because if you don't allow them to ask these questions, because they've already done their research, they're like, my God, am I having this? Am I having this? So it's more of me convincing them that, look, because of so and so reason, I don't think this is your diagnosis. Because of so and so reason, I don't think this. I do think that you have this. Therefore, I'm starting you on this. Right? Some people automatically have taken the medications. Right? They've taken, I've been taking this. I'm like, have you seen a doctor about it? No, I just thought that I have these symptoms, therefore I just took it. So, it's sometimes very important for me to say, look, I think this is a good idea, but next time that you do, make sure that you speak to someone before you do. Because you do not want there to be a problem with overtaking a particular medication. Right? So that's something that is there. And we know that it has been there. And we try our level best to give them that guidance that it's okay for you to Google your symptoms, but don't over Google it. Right? What I mean to say is, don't overthink about it, because I'll tell you something.
Yeah.
Every symptom that you put on Google, somewhere down the line, it is going to come out to be cancer.
Yeah.
Right? And then, like, that's the biggest fear, right?
Yeah.
And cancer is something that anyway creates fear.
Yeah.
And I think that's very important that, it is valid for them to do so.
Yeah.
But it is our duty as doctors to make sure that we clarify it.
Right.
Right? It all depends on how good we are in, obviously, our skills, our knowledge, and how we can make sure that we bring comfort into that person, whoever patient that has come to us, letting them know, look, I can tell you without a shadow of doubt that you do not have any features of cancer.
Yeah.
And you can chill, right? You don't have to worry.
Yeah. So these are different kind of patients that you see, like, day to day, right? My next question is, like, have you ever had a moment where listening to a patient change your diagnosis or approach entirely different? Like, your approach is different.
Okay, that's a good question. I mean, so basically, when I do see a patient, sometimes there can be a time.
That's fine.
Where,
you can close it. Yeah. There's a lot of background noise.
Yeah, that's okay.
Yeah,
the
that's
patient
fine.
was leaving.
Yeah.
Anyway, point being, well, there have been patients who have come in with a physical problem. Like, for example, let's just say they've lost considerable amount of weight, right? And they are worried because, one of the common features of loss of weight, like around 10 kilograms over around 2 to 3 months, right? Like, oh my God, you have some sort of cancer.
Yeah.
And that's something that, warns them, and they come to you. I've had a very recent patient who had, obviously I can't mention more details,
please.
But basically loss of weight for the last, I think lost 10 kilograms over the last 1 to 2 months, and was worried that there was a risk of cancer.
Okay.
Right? And I feel that person's concern is absolutely validated, and we did a set of tests.
Okay.
Right? We did a set of tests. But deep down, I felt like there was a component of anxiety.
Right.
I knew that there was anxiety.
Right.
But I wasn't sure if the anxiety was the fact that whether there was fear because of cancer, or was that anxiety already there before itself?
Right.
So I was I was not sure, but I knew that component was there. We did a set of tests, you name it, we did it, to make sure that I objectively knew there was no risk of cancer.
Yeah.
Everything was clear.
But as a peace of mind,
I did it,
all the
and it
tests.
was all clear. And then it was found out that it was just anxiety. The patient had generalized anxiety that made them feel like they did not want to eat, and therefore they lost weight.
Right.
Very straightforward.
So here at Vida, actually, Dr. Buran actually see a variety of patients, patients from teenagers to their late teens, 30s, 40s, and all up to 60s, and retired people as well, domestic and foreign. So changing a little bit of your approach when it comes to patients, Dr. Buran, how do you now you can actually handle the younger patients, but when it comes to the elderly patients, because I've seen that you have handled so much elderly patients throughout your time here, especially at Vida, what is the differences? Because there is this huge generational gap as well, right? How do you differentiate the younger patients and the older patients? What is your approach when it comes to the elderly patients?
Well, it's very simple. I again.
And they might even, they might even sometimes judge you, saying oh, this is a young doctor. Have you ever had those kind of experience of feeling during your time, you see thousands of patients, and you see a lot of elderly patients as well. Have they ever this is the mindset of have they ever doubted you when it comes to your diagnosis or something like that?
I don't think they've doubted. Obviously, that has been there, but it again depends on how well you are obviously you're knowledgeable with regards to the diagnosis.
Right.
I mean,
Obviously.
it just shows basically based on their first impression, is this guy who's just saying things when he doesn't know?
Right.
I mean, how confident he is with regards to his approach. So I think you've got two parts of your question, and I think the first part is, how do I change my approach when it is someone like you versus someone who is in his early 50s, early 60s, I think it will be more, with you, it would be more casual. I'll speak your tongue. I would be I mean, you were the type of person who would have definitely gone to Google and you would come in and you would try to,
Hey, doc, I'm dying like next 24 hours.
But when it comes to an elderly person, sometimes, the diagnosis is very straightforward.
Right.
And I think it is more of, making sure that I am... I feel elderly patients most of the time, they do not need more medicines, but they need actually time.
Time to talk?
Time to talk. Sometimes that's the thing that they're really missing, right? Because they are old, they do not have anyone at home. Most of the times I've seen patients, elderly patients, who is just the Sia and the Archie. There's no one else at home. There is a caregiver, right? A maid or a servant. Son or daughter, I would be in conversation with them over the phone because they are either abroad or they're somewhere else. Right? And when I notice that, I just take my time in asking, what did they have for lunch? What did they have for dinner? Right? Depending on the time of the day that I've gone to see them. And just having a conversation. Because I feel like at the end of the day, loneliness is something that I see in a lot of elderly patients. And that is where the physical, apart from the physical component, which is, it's more of the mental well-being, the emotional well-being, the social well-being. And that's where my focus really is. Like making sure, it doesn't matter what exactly that they're going through, but making sure whatever that they have, they're comfortable. Right? They're happy, they're content. And then again, based on how confident I am, when they know this doctor was good, right? Automatically, irrespective of whether I was right or wrong, they start feeling better. And that's what's important.
100%.
So, that would be my approach with an elderly person.
So now you mentioned about your approach. Like now let's get a little bit of the macro size of it, like, the elderly care system in Sri Lanka specifically, right? What is missing right now when it comes to elderly care in Sri Lanka? And now in my questions it says like healthcare, private healthcare providers like Vida, but like not Vida, like everyone, all the private institutions, healthcare institutions. What can we change in this elderly care system in Sri Lanka? Like where are we doing wrong? Because I know a lot of other countries are doing exceptionally well. They do have their different sort of funds. The government is helping, and our government also has different programs, but like how can the private sector actually get involved? Because we have a huge aging population in Sri Lanka currently, and you and I both know this, right? The whole idea, the Vida, we started because of my grandmother and like what she went through during her last bit of years, and how the healthcare system in Sri Lanka sort of failed, especially the home care side, right? But like, now here at Vida we see numerous number of elderly patients, and Dr. Buran is one of them, one of the doctors who actually go and see them in their house as well, alongside with our nursing staff. But like, as private healthcare providers, what can we do? What can we do to help the elderly care system from a doctor's perspective?
Well, I feel like the geriatric system, which is the elderly care, it's a system that I think we are trying our level best to improve.
Correct.
Right? Because it becomes very complicated simply because of the fact that an elderly person, the problem is complicated. Right? What I mean to say is, now you come to me, right, with a cough or a sore throat. I know it's just a cough or a sore throat. I treat you, you're fine. But when an elderly care person comes with a cough and sore throat, patient is taking insulin. Right? He's already on some kind of medication for cholesterol. He's already having a heart problem. Having constipation anyway. Right? So one thing that I always feel, like with elderly care people, I always have a combination of symptoms. Right? So when it comes to elderly care, you need to make sure that your approach is holistic.
Right.
It means that you're tackling every particular issue.
Right.
නිකන් මට කැස්සෙන් බ්‍රිස්සාව treat කරන්න බෑ. I'll have to make sure that I will have to cater to every need. Sometimes, the son or the daughter will say, "Doctor, can you please go and see? She's finding it difficult to breathe." If I ask them, you're finding it difficult? No, doctor. I've not gone to the toilet today. That is their main concern. They don't have any other concern.
Yeah.
So it's just that it's very important that their viewpoint is very different.
Right.
And we need to, again, I think the answer to your question is our topic. It is that we need to be patient-centric. We need to be elder-centric, right? We need to cater to their needs.
Elder-centric, I'm going to take that for the next marketing
so it is something that we need to make sure that we look after them, not just based on what we think is wrong, but what they think is wrong. And I think that's something that I feel like we need to work on. And I think we are working on it. We are working on that, which is why they're calling us back.
For Vida.
Exactly. So that's something that I feel is working.
Right.
And we need to stick onto it.
Right. So this is something that, what do you call, I don't know, what are the unique challenges do you face when it comes to elderly patients when you see them? Unique challenges, I would say. Is it
sometimes it becomes very overwhelming, honestly. It becomes very overwhelming where I guess they say this problem, that problem. Mata meka tiyena, and I'm like, oh my God, where do I start and where do I end? Right. So it becomes overwhelming. So that's something again, I'm so fortunate that my foundation from my internship, I was under an amazing consultant. Right. My first consultant who I had, he basically molded me in such a way where I took it one step at a time. And I'm fortunate that all the consultants that I've been under, they've taught me how to take decisions at that particular time based on how important they are, how make a sort of a priority list or a problem list. Right. So that's something that I've always...
Do you want to mention them,
I mean, I can start off, I would say, from Dr. Krishanta Jayasekar. He's still, for me, the god of medicine. He practices at Kara. He was at Balapitiya and he was at Karapitiya. Then I was fortunate to be under Dr. Nilanga Pare, who's a surgeon, Dr. Nadija Samarasek, who's also a surgeon, Dr. Sumit Premaratna. I mean, those are some of the people that I've worked under, right? And then eventually coming to Kalubovil, I was under Masaima Madam, and I was under Afla Sadiki, who's a very famous consultant respiratory physician. Now I'm fortunate to be under Dr. Ravini Karunatilaka, who's again amazing with her approach. It's all about whenever I see them and the way that they speak to patients and the way that they care about patients, the empathy that they have. It just makes me want to be a better doctor. Right. And it's important that when you're guided by the right set of consultants, right, you will want to be, a better doctor. And there are amazing consultants. These are just examples, right? The Sri Lankan doctors that are out there are really known for their compassion, are really known for the service that they provide.
Correct.
Which is why, I still want to work in the government sector because I get to see that on a daily basis.
I'm talking about the government sector, you did your internship, if I'm not mistaken, in Balapitiya, right? Now that's the Balapitiya based hospital, correct? Yeah. So give us I know we talk about your Balapitiya experience a lot when we meet and when we talk and have chats. But what is now? I'm definitely going. This is nothing to do with here. But I'm just. This is for something people who are watching right now to get a doctor's perspective on how was your internship at the Balapitiya based hospital? I've heard some stories. And they are pretty intense stories and pretty something memorable stories. I think that's the word. 100%. Do you want to just tell one couple of stories that you expect, because I know
so
you
basically I don't know. For internship is usually in two phases. First you have in a sense you choose between medicine and pediatrics, and you choose between surgery and general obs. So 100% I was not even interested in general obs. So I started with medicine. First day itself, I walked in, I had my co-HO who unfortunately met with an accident. He was away, and me and another colleague of mine, Dr. Lakshita, I hope he doesn't sue me for mentioning his name.
Yeah.
Both of us were the only two people seeing two different wards.
Yeah.
I had amazing senior house officers, right? I had, some of them have made me realize how, like in a sense, mistakes. Because as an intern, you make quite a lot of mistakes. But the important thing is learning from those mistakes. Like, I had some amazing set of people who guided me.
Right.
I've made mistakes, man.
Yeah.
I've made quite, like, I still remember how I've made detrimental mistakes where I have been taught how I need to deal with it the next time. Right, with the likes of my consultant, there was Dr. Krishanta Jayasekara. I've had basically Kushan Aya, who was an SHO, Ivanti Akka, Amila Aya. These are all people who, you know, have molded me to being this person. So in a way that I've learned so much through them. But if I have to tell you the experience, right, I'll tell the nurses, Miss Dagna, ඇත්තටම හිතන්නේ නිකන් බස් අරන් කොළඹ යන්න. You know, I always tell, because it became very overwhelming.
Right.
Like, you have a snake bite, and then you have a patient with a heart attack, then you have another patient with a stroke. Because in Balapitiya, when I was doing my internship, we didn't have a PCU. They would just immediately
what's
PCU.
a PCU?
PCU is basically an emergency treatment unit, or like a unit where, you know, they would stabilize the patient, right? Basically an ETU of some sort. They stabilize the patient, and as soon as the patient is stable, they bring the patient to the ward. But what happened at that time, now I think now they have a proper ETU facility where they stabilize and then send the patient. We would get, in the middle of the night, we would get the patient directly. Sometimes the patient is gasping and is coming to the ward, and we have already other patients that we need to look after.
Right.
Dengue patients who are in leaking, I have to make sure that every hour I check their urine output, I do a PCV. So it became very overwhelming, man. And especially by myself. Luckily, again, I had amazing RHOs also who were there to support me. But there were times where I'm like, I'm done.
Yeah.
I just want to leave all of this and just get back home.
Right.
But at that time, when you have an amazing support system, at that time you start realizing, oh my God, you know, I still want to continue.
And the support system is, you're mentioning about the staff and the nurses.
The nurses, like, you know, I have not had lunch. They know that I've not had lunch. And then I have discharges to write. I have this thing where I cannot, like, I will sacrifice things for myself, but I will make sure that I prioritize my patient. I have this, I don't know if it's a bad thing or a good thing. Right, a lot of people think that you need to just give yourself time, but I feel like that's who I am.
I actually have been telling him that for the past
so for me, that I would always prioritize my patient. So the nurses know that I will not. So they would make me a plain tea and keep for me. And so, you know, this is just a simple thing, like, you know, Dr. Ender, come with this cake, have this, and then you can get back to it. And sometimes I'm like, no, Miss Ma, make a ivara line. But I never get that time, free time, because when one thing is over, there's something else that pops up.
Right.
Some patient goes bad. So they know that time will never come. So they'll just come and keep a you know, tea next to me, at least something I'm getting. So while writing a discharge, I have. So that is the support system. My consultant would, you know, check on me every time whether I'm okay, especially after going for a transfer. I mean, that support system makes you realize that, you know, even though that, you know, you're putting your 100% out there, and you might be sacrificing yourself, there is that support system that will look after you. And I feel for me, it just made me more appreciative of what I do, and it's made me, you know, wanting to become better and better and better. Yeah, maybe, you know, there are times where, you know, I'm just like going all crazy. Sometimes it goes until 11:30, 12 in the night. But sometimes when a person asks for help, I have a bad habit of not saying no. Right? And I guess it comes down from my internship, I guess.
Follow up with that question, I was thinking, like, I know a couple of friends, friends of mine actually are going through the internship, and I've spoken to them. Right, and a bit of advice. I mean, like, they go through the same thing, maybe the exact same thing that they're going on internship. They'll be in a government hospital and stuff like that. But like, what is the advice, or like a moral support thing that you can tell? Because you've been out from Balapitiya for how many years now?
So basically, I went for my internship in 2017. So 2017 to 2018, it was just 1 year internship, right? Internship is going to push you, like, you know, would test your resilience, would test your, you know, it tests in every single component. but it's just that 1 year.
Yeah.
Just get through that year.
Yeah.
Make mistakes,
Right.
learn from that mistakes, cry,
Right.
get scolded,
Yeah.
sob, think of, leaving the place, all of those things, deal with it.
Right.
Just go through with it. That's what's going to make you an amazing doctor, right? Just, make sure that you enjoy that process,
Right.
but be open to the fact that every day isn't going to be a good day. Right?
Okay.
That's something that I would tell them, that it's okay. It's okay to get scolded. Yeah. It's okay to be constantly yelled at. It's okay for someone to come and say you've not done a good job.
Yeah.
As long as you keep learning and keep moving forward.
Right.
As long as you do that, right, at the end of the day, you'll be like, oh my God, this experience was valuable. Because I'll tell you one thing, 6 years of medical school cannot equate to that 1 year of internship. You learn so much, man. You learn so much, especially in Sri Lanka. So don't ever come and say a Sri Lankan doctor who's passed out, who's done an internship, is not good enough. Because that internship is what makes you so good at seeing 200, 300 patients. When it's in the Western world, that's like, are you crazy? How can you see so much? But we do it because we do not have a choice, because that's how our government system runs. You look at our clinics sometimes at NHSL, or you go to some of these clinics, it's just like people have come from 6, 7 o'clock because that's the service that we give. And doctors go there and make sure that they see all these patients in that little limited amount of time. So, why do you think that we are competent to do that?
Yeah.
That's because of the internship.
Yeah. Well, something like I feel like we're going off topic, but it doesn't matter. But like
really off topic.
Very off topic. But like I really like this.
I think Deshan's like, are we in the right?
I was like, are we done yet? I was like, yeah. No, I also want to emphasize something that if people are watching, our podcast and right now, and you must have seen Dr. Buran on TikTok and all of IG, and we all know him as Dr. Buran. And what made you, like, why you want to be a doctor? Like, I should have asked you that early on. Like, everybody knows you as Dr. Buran.
I actually feel like, honestly speaking, I think my mom secretly manipulated me in becoming a doctor. I don't like to use the word manipulated, but I feel like it was always her dream to be a doctor.
Yeah.
So I don't know, maybe she bought me stuff that was like, I had a doctor set as a kid. Like a proper doctor set.
Right.
I think if I looked through my stuff,
Parents, if you're watching this, if you want your kid to be a doctor, get that doctor set. Reach out to Dr. Buran's mother.
I think it started off with that.
Yeah.
But it's just that something that always made me want to, get into it. It was like, I felt like doctors were special.
Yeah.
Like the amount of respect they got,
Yeah.
and the amount of authority that they had, the amount of, the value that they were giving to patients. Because as a kid, I would be fascinated towards going to a doctor, right? And like the way that they're second to God, right? In Sri Lanka, that's what the status was.
Yeah.
So obviously, there was like, oh my God, the amount of respect, the amount of things that they were doing, the service that they were doing, and it was amazing. And honestly, I shouldn't have done medicine, right? Because my brain was catered towards physics, right? And my dad was like, you need to do something with regards to engineering and come and help me out with his business, right? And it was always there. And biology was always very, a little bit of effort I needed to put in.
Right.
So a traditional parent would say, you're good in physics, go do engineering, right? Why are you doing medicine? But I don't know why, deep down I was like, no man, I wanted to go into medical school.
Right.
And believe me, when I was in medical school, there were times there was a lot of oh my God, am I doing the right thing?
Yeah.
Is this the right thing?
Is this the right thing?
Because again, medical school is also a test, man.
Yeah.
It's
6 years in medical
6
school?
years. I was there 6 years, man. So there were times where I would be like, I'm done.
Yeah.
Have I made the right decision?
Right.
But bro, right now I can tell you, this was the best damn decision that I've taken, man. No doubt.
Glad.
It's not, again, like you said, it's not about the money that we make.
No.
It's not about all these other things that you get as pluses.
Yeah.
but it's that satisfaction.
True,
Man.
true.
Like you go back home
Yeah.
and you know that you've made someone else's life better.
Yeah.
You know, you've helped someone out. It could be the smallest thing,
Right.
but you've changed.
Yeah.
And I think that's where, answering your first question, why Vida?
Yeah.
Right? I think that's what you made me realize. Like, look, this is why I decided to be a doctor.
Right.
And I think that's why Vida works, and we have been doing it so far.
And I want to wrap up with like one more question, and
the pizza is getting cold.
The pizza is getting cold. We ordered 3 large pizzas, guys. Like it's like about 8 o'clock. Guys have been working around the clock. Dr. Puran has been working around the clock. So so for the last question, I wanted to ask you something related. Like you've been here for almost 5 years at Vida. What's changed the most, and what stayed the same?
I think we have, again, it's about us becoming better.
Yeah.
Like me as an individual.
Yeah.
Becoming better day by day, learning. Right? Because every time it's a learning game, So I feel like what's changed is that we've strived to become better and better. And I think the organization, from a nursing point of view, from the reception's point of view, from the whole management point of view, we've tried our level best to improve on a day-to-day basis.
Right.
But I think one thing that has been constant is the patient-centric approach.
Yeah.
And like when I say patient-centric, I mean like sometimes we have a patient who's an asthmatic, right? Who's using an inhaler, right? But no one has got to the point of teaching that guy how to use the damn inhaler. Taking the inhaler, the medicine is being given, but the inhaler is not how to use it. I've had a patient who comes to the clinic, no, I know. කොහොමද පාවිච්චි කරන්නේ? ඕ මම පෙන්නන්න මේව. Right?
Okay.
And that's how they use the inhaler.
That's how they use it.
And they think that's right, but you see, they're giving some of the best medicines, but ඒක පාවිච්චි කරන විදිය is wrong. So that's where we need to make sure that we find out as to how, and we sort that out.
Right.
And I feel like that has stayed the same.
Yeah.
That has always stayed the same.
Right.
But we've improved.
Yeah.
We've used technology. We've used ChatGPT, man, to become better, right?
Yeah, and we're proud of it.
Yeah, we're very proud of it because it has helped patients.
Yeah.
And if it has, I think that's to it.
Yeah. All right. Thank you, Dr. Buran. Just want to give a special shout out to the growthing team who's here, who's doing the production there, and they're in the back over there. Shout out to, actually, we should give a shout out to our staff at Vida, to be quite honest. Our nursing team, rest of our doctors. There's a bunch of other doctors who are also here. Management team who's always been in the behind the scenes doing so much. And so this concludes the second episode of Vida Pod. Very long Vida Pod. So the host is going to change around here. So like probably next episode, Dr. Buram might be the host, and some other doctor will be here who is also consulting at Vida. So we just want to keep things interesting as well. This is my first ever podcast that I've been hosting and just being in a podcast. So thank you everyone for joining us in. And leave some comments, like, we would like to hear what you guys think when it comes to Vida, or like, if you want to like hear something out, medical related something, always shoot out something on our socials. So until then, thanks Masha.
Thank you very much. Yeah. It was an honor. It was amazing. It was amazing.
Was it good?
Yeah, definitely. It was great.